folks representing the block grant discussion. And Jamie, do you want to get things started?
Yeah, there's been a lot of discussion over the block grant for the last 6 months already, I guess, probably longer for these folks. But last week there was an email that was sent from DPW, which kind of made it really, to me anyway, real. It's been, I think, a lot more discussion for these folks. But what DPW was asking for each county to submit a channel for the block grant funding to flow to the counties. As it stands now, each of these agencies get their own flow, whether it be by check or by electronic fund transfer of state money, and the state's saying we're only going to send it down one pipeline, so tell us which one, and also give us a point of contact. And to me, at that point, it got kind of real. Yeah. So I briefly talked with each of you about it, and have been talking to some of these people, and we all agreed it would be a good idea to just open this up a little bit and have this discussion. And even since last week, it's become, you know, the heat's getting turned up more and more on the burner, and we're closer and closer, I guess. And I'm hearing now that the state is, they want the block grant so badly that they're willing to negotiate some restoration funds in order to ensure that they get the block grant put in place. So, so these four agencies here are the ones that would be impacted by a block grant, and kind of gets us to today. If we want to just have a discussion, not a real rigid format here, but just something where each agency can talk a little about what the impact could be for your agency, what types of things you have in the hopper, so to speak, ready to respond if there are cuts, and to what degree, and then also to resolve, I think, just at least those two questions that DPW is looking for an answer on.
Okay. Right. And before, excuse me, you folks start to share with us your view of the future, do either of you have a comment to make before they start?
I don't.
Oh, I guess I could. I know I've been trying to share some of the information because with the County Commissioners Association of Pennsylvania, I knew that this was real and had participated with Lieutenant Governor Jim Cawley in a press conference, because we were told that we're going to get cut no matter what. So it was a matter of trying to figure out how to make the funds go further. And the block grant made sense, and it has been on CCAP's platform for a long time. They do votes every year, discuss the issues, and this came out priority number 1 this year. So that being said, I worked very hard with the County Commissioners Association, and we have weekly conference calls. And as Jamie said, the governor, I think, even has verbally said if there's a block grant, you know, he'd be willing to sign for no less, I don't know if I should say no less or no more than the 10%. So hopefully it'll do better than that, but there's no way to know that. And I guess, you know, if there's an efficiency in this, it would be that instead of each department having to make a plan for submission, which takes a lot of time and paper and copies, and each department having to do an audit, and each department having to do bookkeeping, etc. Some of those things can have an efficiency because it's one large sum. But from what I'm hearing internally, if we would like to set up a process where we still give each department X number of dollars based on the percentage they are today, that's our doing. So how we decide to do it internally is something that we will have to discuss. But I thank you for your patience, your understanding. I know this is not easy for anyone, but if we're going to get cut, we have to figure out how to do it better and more economically, and still give the best service to the clients. And that's what we've been trying to work for. Thank you.
And further efficiency might be, this is kind of a naive maybe observation, but if in your department, Jim, you have 5 streams coming in now, would that give you the latitude to move money where you couldn't before, you may have to give it back if you didn't use it all in one funding area, that this would give more latitude in that kind of an area? Is that a possible benefit to this kind of a setup?
We've always had the flexibility within our budget to kind of move funds around a little bit.
Okay.
But what the state did here a few years ago, they came up with the concept of special grants. And if you were going to provide certain types of services under these special grants, Pennsylvania Promising Practice Evidence-Based Programs, you could apply for a special grant where the reimbursement rate from the state was greater. It was 80-20, and now through the special grant process it's 90-10. So it obviously saves the county money. That portion of our budget has been moved over into a special grants category and now has been put into the block.
But another advantage to the county would be, right now, I think sometimes we end up fronting the money and having to wait to get paid and or returning money, and there's bookkeeping with that to return money at the end of the year, where in the new system, we would be getting quarterly payments up front, number one.
That's correct.
And number two, at the end of the year, we would not have to give the money back. We could just report that we're going to carry that forward, and then we could utilize it in the next
That's
quarter.
correct, but I think that's kind of clouding the thing. There's not going to be money left over when you're getting cut. Yeah,
Theoretically.
And that's my biggest concern with the block grant. I've done a lot of research on it. They're saying, well, you know, if you have money left over, you don't need to return it. I can give it to Kevin, or we can get together as a group. Okay, there's more of a need for drug and that sounds great on paper, but when you're getting cut 10% or 20%, you have all this flexibility. Well, there's no flex left if there's no money.
Right.
So we're not going to have money left over.
Very good point.
And I think when you start to, I understand the County Commissioners Association taking a very positive stance on this, and that's fine, but you know, I try to dig a little deeper, and I'm always kind of looking. It seems to me that just gives another bullseye for the state to look to make additional cuts down the road. Okay, and then what happens, the pressure's going to be put on the county. Well, if you want to continue with these programs, you're going to have to come up with the money. We're going to cut. And I'm just concerned that this is just another avenue where they're going to be able to make cuts, and the county's going to have to take a stance. Well, we're not going to fund non-mandated services, so we're going to have to discontinue programs. That's my
Couldn't they
concern
cut
down the road.
anything anyhow?
Pardon?
They could cut anything anyhow, right?
That's correct, but they're left mandated services, from my perspective, they can cut, but from my budget, gives me, still have a little bit more flexibility to try and move things around to make up for, if they cut me in counseling dependent, for example, well, maybe I can take some out of foster care to make up for those cuts.
So you're saying that it makes it easy for them, it's just, well, we're different.
I think that's what we need to hear. Are there efficiencies that are going to result in some payroll or, you know, people savings that will help offset versus direct services suffering? That, you know, if you have any thoughts about the fiscal savings.
I'd have to turn that over to you folks, because their chunk of money is much larger than what I'm looking at.
There is an advantage in having the flexibility. Again, this is all, again, Bill would complain is we're flying it here and we don't know the answers, and it seems like things are changing every day as we get closer to the end of the fiscal year. But as we understand it, there's some flexibility here in being able to put all the money into one pot and use it as the county sees fit. I don't know that, you know, within a smaller county like ours, that there's going to be any efficiency in terms of reduced staffing, which would result, and maybe other folks feel differently, but I don't know where we would necessarily save on fiscal staff or administrative staff, because like Jim says, we still have to do plans, we still have to do budgeting, we still have to do invoicing and accounts payable, accounts receivable, you know, all the things that we normally do are still going to be there, and it's not like we have large staffs in the first place. So I don't know that we save any staffing, but the flexibility, I think, would be a benefit. But I keep saying, when I go to meetings, that we're all focusing on the block grant, and to me the issue is the cut, whether it be 10% or 20%. That's a much larger impact than just whether or not we pull the money in a block grant. We can work together to deal with the block grant issues, but how do we move ahead with such a significant cut after, yeah. So I mean, that's the perspective. My sleepless nights are about the cuts, not necessarily the block grant. I don't know how it affects drug and alcohol, if you feel any differently, or Phyllis.
For drug and alcohol, it's a very small percentage of the funding that we would receive that would be included in the block grant. So when you talk about savings from the combined funding, we're only putting 20% of our funding into the pool. So we still have all of our reporting requirements that we must make to the Bureau of Drug and Alcohol Programs. So the portion of our money that would be in the block grant would, only involves a small amount of reporting. So merging that into what we report with the block grant isn't a huge savings in and of itself.
I'm told that the spreadsheets will be like an Excel format, and there's going to be a lot of duplication and unnecessary information taken out, and they're just going to ask for what they really need. But that,
and I've heard that as well.
Yeah, what that means, I don't know.
Yes.
And Jim, I heard her say 20% of her total budget is in this block grant. What is the percentage of your?
Oh, I didn't even, we're looking at only about $48,000 total.
And that's what percentage do you think?
Well, it's $7.1 million budget to take 48,000, $7.1 million budget, 48,000, whatever that comes out to. It's a very, very small percentage. It's mainly my truancy grant and my housing grant.
And how about mental health retardation?
It's the entire mental health budget and the entire intellectual disabilities budget. For the MHMR program, the only thing that's excluded is the early intervention program.
So pretty much 100%. And then for CAP?
I don't have the percentages, but in terms of the dollar amounts without the cuts, between 200 and 300,000.
And your total budget again is?
My total budget?
Yeah.
Just calculated that, 2,500,000.
Okay. Thank you.
I wanted to direct a question to you, Commissioner Litz. With your active role with CCAP, is there any indication that along with these budget cuts there will be changes in mandates, modifications to mandates, or is that not on the table?
I haven't heard that there would be changes in the mandates, no.
No, I haven't.
I think part of what they're looking at is that there's dual diagnosed patients, mental health issues and drug and alcohol issues, and what if it's also a youth? I mean, this way supposedly, people have gone to jail because they don't spend money in the category that it was appropriated for. So this way it takes away that control from the state and puts it at the control at the local level, so we can decide if we have somebody who takes all these services that we can move the money or around and make it happen locally. We don't have to ask for permission, and we're not going to get in trouble with the state by moving that money around.
You're saying we could serve them through one agency and rather than three or something, is that what you're saying?
Well, the funding doesn't have to come from a specific agency because it's one block grant, where before each one had to spend it categorically, if that makes any sense. On the same client, yes.
Okay.
I would suggest that's not been a major issue.
I was just going to say the
Bigger
same thing.
counties maybe, but if I've got an individual we're dealing with that has problems that's also being served by children and youth, we can talk to each other and work those things out.
Yeah, we pretty much then decide who's going to be the lead, who's going to
I think you
provide
guys do a
service.
swell job of that. It's just that now you don't have to worry about the bookkeeping for the categorical.
Or maybe worry about it in a different way.
They don't know that. They're not certain of that, I don't think.
But the bottom line is, at this point, we're looking at whatever cuts, at some point the services are going to be curtailed, and you have to decide as Solomon, where in your programs are you going to implement those cuts?
And we'll be the bad guys in the end, because I think all of you are aware of the situations that we're in financially in the county, so it would be nice to say, well, what the state doesn't give you,
Shift it to us, yeah.
we'll send it right on over, but it's,
The well is dry.
yeah, it's not gonna happen.
And honestly, that's the other challenge that Carol and I and the administrative team are talking about. We don't know how much the commissioners are gonna be able to support us financially, you know, with the unknowns that you're facing. You know, you've always been very supportive of us at budget time, knowing what our needs are, and there's only so much you can do, because you only have so much money, so, and because our years overlap, it's very challenging to, you know, try to predict what you're gonna do financially for 2013, but
Right.
that's gonna be half of all you can do.
I might ask, how does one, 4 counties get this much ahead of the curve? I don't understand.
I have been
Unless they had
asking that,
inside
I have been
information or
asking that question too, and I have not gotten a straight answer. I've been trying to get a complete list of all the counties who are ready to go, and I've gleaned 5 of those counties, but to this day I haven't seen a complete list. If I missed it, then a bit shame on me, but I haven't seen it. County,
Berks County was one,
Lancaster, I think,
Lancaster,
Chester,
Tioga,
and, yeah, Tioga.
and Potter, yeah.
And Potter, that was, Mark Hamilton is Tioga. I
Or the
think.
cutting edge.
Well, all I can say is thank you for all you're doing and all you will do, and we'll do everything we can. I hope I'm not speaking out of line to support you in what might be a very difficult time.